Good evening to you all. Good evening and welcome to my live. Welcome to the live. All right. Welcome and thank you for joining me tonight. Usually, I would introduce myself before anything. I promise to teach us today on the herbal remedy to malaria and typhoid. Malaria and typhoid. This is like the silent killer that we have around us. It's always something that is reoccurring around here. This is like the major problem everybody in Nigeria is facing. Most people in Africa are facing this malaria and typhoid issue. And today I decided to teach us on the remedies that you can use for your malaria and typhoid. The herbal remedies that you can use that are very effective. But before I go on, I would like to call out my number again like I usually do, so that whenever you watch my video, you hear my number. If someone else is chatting you with a different number, you will know that this is definitely not me. So my only phone number is 070-305-70506. Of course, the code is +234 705-305-70506. All right, so let's talk about the malaria remedy. The malaria remedy. I hope you guys are here with me. All right, there are certain things for malaria. The key herb that you need when treating malaria is neem, what you call dogoyaro. Dogoyaro, neem. That is what you call it. Dogoyaro is very effective in the treatment of malaria. Now, something else you can use to treat your malaria, something else you can use is pawpaw leaf. Pawpaw leaf, that is another thing you can use. Pawpaw leaf also works for typhoid. Pawpaw leaf, yeah, akwukwo pawpaw. Dogoyaro leaf, get a good quantity. Dogoyaro leaf, you're treating, usually two of them come at the same time. You're treating a combination of malaria and typhoid. You will be needing dogoyaro, a good quantity. Pawpaw leaf, maybe you can use up to three of them. Pawpaw leaf, you can also use guava leaves. You can use swasop leaves, as it doesn't do well, it doesn't tolerate parasites or any cancerous growths and all those things. Now, what do you do? What do you do with these leaves? When you're treating malaria and typhoid, dogoyaro, pawpaw, guava, you boil with neem. Now, there's this plant called ovoro. I don't know the English name, but when next I come across it, I'm going to snap it and show you guys. The plant is called ovoro. It's very good. Ovorino is very good for typhoid, especially, not really typhoid, even malaria, for any kind of fever. With this combination, you don't even need the pawpaw leaf. That's combination of ovoro and dogoyaro. You will not even be needing pawpaw leaf or guava leaf if you can get that one. But aside pawpaw leaf and guava leaf, you can use combination of dogoyaro and ovoro. You add this ginger. Why are you adding this ginger? Ginger, just like ginger your swagger. Ginger is like a catalyst. It has a way of speeding up reaction. When you take that herb, it's a kind of increases your blood flow, the way it goes into your system. Any woman that is having painful menstruation due to lumps of blood would know that when you chew ginger, it dissolves it. So imagine when you put this thing, it helps easy movement of those herbs into your body. You boil it. If you're boiling any of these herbs that I mentioned, if you're boiling them, you make sure that you're boiling it. It shouldn't be more than 5-10 minutes. Once it starts boiling, please turn off the heat. Because anything further than that is more like you're killing those chemical constituents that are supposed to help you, that are supposed to make you okay, that are supposed to heal you, that property of it that is supposed to heal you. You're killing it with the heat. So anything more than that 5-10 minutes is not allowed. When you prepare it, you let it steep in there. Now, how do you take it? If you're putting ginger, please smash it. You can use your blender or you can use mortar. Just, you don't need to make it into powder, just in such a way that it will go down well inside the hot water. How do you take it? Some people will tell you, do not take herbs. It doesn't have dosage. Herbs doesn't have dosage when you have not met a good herbal practitioner. That is when it doesn't have dosage. Not when you have someone like me here instructing you on how to take these things. I've used these things over time, and I can confidently tell you that they are working perfectly fine for malaria and typhoid. These are the ones that you can get around you. There are so many other herbs that does these wonders, but these are the most common ones that you can use. Now, how do you take it? Now, the best time to take your herb is in the morning before you eat. Before anything goes into your mouth, that is the best time for you to take your herbal remedy. The best time any herb is in the morning before meal. You take this herb, it goes into your body. There is no interruption. You know, we eat a whole lot of rubbish. The kind of rubbish we eat is too much. We eat so many things that affects our health without even knowing it. So the best time for you to take any herb is in the morning before meal. You warm it. If you're going to warm it, please, you're not warming it so it will start boiling. Now, after boiling this thing, your dosage, like I said, greetings, my queen. Like I said, the dosage after boiling it, you take 1 glass. It's not kukuma. It's not that glass you used to take all those your brukutu, all those your palm wine, all those big tumbler. Who send you cup? It's not normal glass that normal people, that civilized people use. Oh, glass and dindo to use normal glass. That is like about maybe, let's say, 500 ml. Normal glass. You take it in the morning before meal. Then the next time you take it again. For severe conditions, when you have them in the morning, assuming you eat by 9 a.m., you should have taken this herb by 7 a.m. Assuming you're someone that eats by 9 a.m. So it should be the first thing that enters your mouth. You take it, and in the morning, in the afternoon, for severe conditions, in the afternoon, when you're feeling hungry. When you are feeling hungry, you can take another glass. It needs to go on empty stomach. So if you're someone that eats very late, maybe you eat around 9 p.m. or 7 p.m., let your food digest. The last one you take is before your bedtime. If you're going to sleep by 11, take it by 10:30. If you're going to sleep by 10:30, take it by 10. But make sure that your food has digested properly. You take your herb. If you don't let your food digest and you take herbs, here is what it's going to do to you. You're going to feel a kind of constipation. You're going to feel it fermenting in your stomach. You'll be releasing gas, unnecessary gas. And you can feel the gas, the movement of the gas in your stomach. That's the way you will feel about it. When you take it, you just take herbs in between meals. That is wrong. You don't take herbs in between meals like that. You wait for the food you have in your system to digest before you start taking it. So this is your dosage. Now, depending on the amount that you got, you take it for 5 days, 5 to 6 days, and then you throw it away and prepare another one. 5 to 6 days, you throw it away and you prepare another one. All right? Throw it away and prepare another one. That is one of the reasons I do not advise you to buy some herbal drugs herbal remedies that are conked inside bottle and out there, especially for all this typhoid and malaria and all those things. You know the reason why I will not advise you to do that? Some of them are not using good preservative. Some of them use rubbish to preserve it, and you end up poisoning your system. You end up endangering your kidney. That is why some people, if you know me very well, you will know that I do not prepare herbs and keep. I prepare herbs based on the need. Sometimes I might even prefer giving you the dried ones because I dry them at room temperature after sourcing them. Because I know preparing it to keep is not healthy. The shelf life is better when it is dry and you let the person prepare it by themselves than preparing it and keeping it, and you end up, it won't be that effective. It's going to smell. It's going to rot. All right? So it's best taking fresh, electric, the way it is. So that you know what you're buying out there. You know what you're buying. All right? So these are the herbal remedy for malaria and typhoid. When I see that ovurini, for those that are watching this video, when I see it, I'm going to snap it and I'm going to post it so that you know. I don't know the English name so far. I don't know the English name. So when I see it again, I'm going to snap it, because if I snap the dry one, you're not going to recognize it. Probably the next time I go to Enugu, I'm going to snap it and show you so you know what it looks like. Or if I see someone that can snap it and send to me, then I will definitely show you. All right, so if you have any question based on what we have discussed about the malaria remedy, please bring it on. Malaria and typhoid remedy, bring it on. And it is good to repeat this treatment. You take it for 2 weeks, you take a break, repeat it as often as you can until your system is completely free of these illnesses. And you will see that it will get to a point when you know that water is normal for an African man to go to the hospital, and then you see malaria, you will see that no malaria in your system will become normal over time. So this is the way you treat malaria and typhoid. So if you have any question based on the herbs I mentioned and how to do, the medication has dosage. It seems you've not been listening to me. I've been telling you about the dosage. I said a glass cup, and I described the glass cup you would use. I said not more than 500 ml. Not more than 500 ml in a go. So you have to play this video again. If you're not getting it on TikTok, you go get it on Facebook or on YouTube. It should be on YouTube before tomorrow evening. Before the end of tomorrow, it should be there. Yes, it has dosage. It has. That's why I said some people will advise you against herbs because they claim there is no dosage. That is when you're dealing with someone that is not trained. Someone that doesn't know what they are doing. Someone that is copying some things online. They don't even know how to administer it. They don't even know how it reacts with your body. They don't know. Because I heard recently some people are mixing tin tomato paste and malt for blood. I don't know who is teaching you people this kind of poison. Richards. I don't know who is teaching you people. Some of you are poisoning yourself. Which one is drink malt and tomato paste? Like tin tomato and malt. What is the color of your madness? Like you're poisoning yourself. You're overworking your kidney and your liver. Now, let me tell you, with most of the medications, orthodox medicine you take, you endanger your life. Most of them, the side effects, you won't believe the side effects. But you know we don't like to read. When you read them, you actually see that they're telling you this is what this drug is going to do to you. But because you're not used to reading, most of us that have ulcer, it was caused by paracetamol. Most of us that have ulcer, it was caused by Panadol, paracetamol, all those analgesics, causing you ulcer, but you don't know. Blessed AB, what are you talking about? Red? I don't understand. You said something about red. I do not understand. I'm waiting for your question. Do you have any questions so far? Good evening, Everlove. Do you have any questions so far? Okay, a medical practitioner is saying it. As little as people see paracetamol is very dangerous to the liver. That's a medical practitioner telling you. For some people, they chop them. They swallow it like vitamin C. Small thing, your eye turn you take paracetamol. Head turn you take paracetamol. Stomach worry, you take paracetamol. Leg pain, you take paracetamol. Don't know you're killing yourself. Look at everywhere, kidney problem. Everywhere, liver problem. Everywhere, cancer. Everywhere. 50% of these cases is caused by the drugs you're taking. That is why I'm teaching you these herbal remedies for free. That is what your body accepts. But we are not ready. Red is color of madness. Mixing tin, tomato, and malt. I don't know who is teaching them. And you mix tin, tomato, and malt, and it will give you blood. Tin, tomato, and malt. I don't know how tin tomato supplies blood. I don't know how malt supplies blood. I don't know who even decided this mixing. Like, this is what people do. You mix two different chemicals. Tin tomato, before I use tin tomato to cook, know that I do not have any choice again. Because I know it's poison. And somebody will now mix it with malt. Even antibiotics are deadly to kidneys. But people will be taking some girls are swallowing, they'll be swallowing amoxil to prevent pregnancy. I didn't know that amoxil prevents pregnancy. The way they swallow it. Good evening, Lolo. They swallow it like vitamin C, like water. And then some people will be taking drinks. Some men, they will be putting tramadol inside. Like, I don't know the color of their own madness. And after you get kidney, and one innocent woman somewhere, kidney problem, be somewhere carrying you up and down. And you don't want us to hear online. When you were living recklessly, you are not listening to advice. If you see this kind of video, boy, kana akoyeri. Oya na awara ama. I can easily keep this remedy to myself after I get money from people that come for me to treat them. But I'm sharing it for free, so if you know how to help yourself, you can help yourself. Exactly. Nigerians do not read side effects. Even talking side effects, even all the apps we are using. Sometimes when I buy phone, you see all those places that write terms and conditions. I used to piece people that are writing it because we don't used to read it. You don't agree. Shebi you want to use the phone. You don't want to use the phone, you will not agree now. You want to use the phone, but you don't even know what is involved. Just click agree. That is the way it is with the leaflets inside all these medicines. We don't want to read them. You don't want to know the contraindication. You don't want to know. You just take them, swallow it like it's food. And in the long run, you start having problems. Who are you going to blame? There are so many things I would like to say, but I don't say everything online about the drugs that we are taking because I know what I'm avoiding. So I don't get to say everything. I can only teach you the ones I can teach you. If you want to use them, fine. If you still want to be doing Yibo, continue. That's fine too. But at least I would have passed the message to you. Alabuki inside hot drink. Oh my goodness. People take a whole lot of nonsense. And I'll tell you, it's working. It's working. Take it, it's working. Your kidney. See your kidney, see your liver. Okay? You go to drinking competition. Your kidney, your liver. Imagine your phone. When you download certain apps, heavy apps on your phone, imagine what the weight does to your phone. That's what you do to your kidney with the kind of things that you take. You overwork your kidney, causing it problems. Over time, it wears out. You start having kidney failure. Your phone does have failures too, memory failure. That is what you do. You can no longer process the things going into your mouth. And when it starts disturbing you, will not allow us to rest. We'll be seeing posts all over social media. Help us share, my friend, kidney, I've been down for. But when they are giving your friend advice, your friend is not listening. Your friend, the one and say, well, I get coconut head, I know they hear something. I must drink, I must do this, I must do that. I'll continue taking this. Especially men. Men that are doing all these hard jobs. They are working in all these construction sites. Those ones that carry all those head pan. Maybe that carry all those blocks to the foundation area and all those area where they lay the blocks. At the end of the day, you find out that all your body is paining you, but what do? You go and buy Panadol. You buy the diclofenac. Some people, they chop the diclofenac like, oh, they chop on like puff every day. Diclofenac every day. Diclofenac every day. Diclofenac. All those dog man will sell it to you inside the bus. Tell you this is the best pain medicine, rheumatism, arthritis, all the sickness in this world. Diclofenac, and you buy it and you are happy. You drink it, you get relief, you are happy. I'm sorry, you're digging your grave. Temporal comfort, temporal relief, that's what it gives to you. With this, but it's all right. I'm going to stop here. If you find this informative, you can equally share so that others can learn.